Can you all see the screen? If this
Yes,
one of you
ma'am.
can respond, please.
Yes,
Yes,
ma'am.
ma'am. Yes, ma'am.
Am I clear?
Yes, ma'am.
Yes, ma'am.
Okay. So this is going to be your first class in your third year, and we'll be going to start with your removable partial dentures. Second year, you have seen regarding the complete denture fabrication. And third year, you're going to deal with removable prosthodontic or removable partial dentures. So according to the glossary of prosthodontic terms, the removable prosthodontics, it's defined as a branch of prosthodontics concerned with the replacement of teeth and its contiguous structures for edentulous or partially edentulous patients by artificial substitutes that are removable from the mouth. You can see here there are two pictures, which is the complete denture and the partial denture. So the main difference is in a complete denture, it is going to cover all the elonging supporting structures. It's going to take the support from the adjacent structures. But whereas in a removable partial dentures, it can be two-way. It can be a tooth supported or a tissue supported. So the process which you are going to see here is a tooth as well as tissue supported prosthesis. And the removed partial denture prosthesis is also defined as a prosthesis designed to replace teeth in partially dentate arches. It can be removed from the mouth and replaced at will. There are different types of removable partial dentures. It can be called as interim prosthesis, the transitional dentures, or the treatment partial dentures. Generally, these treatment partial dentures, they're termed because they're going to be given to the patient only for a specific period of time. That is, a dental prosthesis used for the purpose of treating or conditioning the tissues. Whereas the interim prosthesis, it is a fixed or removable dental prosthesis or maxillofacial prosthesis designed to enhance the aesthetic stabilization of function for a limited period of time, after which it is going to be replaced by a more definitive dental prosthesis. The similar way with transitional denture, the partial denture is going to serve as an interim prosthesis to which the artificial tooth will be added as natural teeth are lost, and they will be replaced after post-extraction tissue changes have occurred. The main difference is in this transitional denture, though it is also an interim prosthesis, it is going to replace the teeth in an incremental order. So this is because the patient should not feel any bad for getting the teeth extracted. So as soon as we're going to extract the teeth, the denture is going to be placed into the patient's mouth. In an incremental order, it is going to be replaced. Once the tooth is extracted, we are going to add another tooth in that place. So it is also called as immediate dentures, immediately after extraction. And the potential benefits of RPD, it is appearance, enhancing the appearance of the patient. So now this patient is edentulous where the central incisor is missing. You can see this picture here. The space available is going to be decreased because of the movement of the adjacent tooth. So before the patient is going to be replaced with the other treatment like a fixed prosthesis, we are going to give a temporary prosthesis, which is a removable prosthesis, so that this space is going to be preserved, and thereby it is going to enhance the appearance of the patient, and also the speech is going to be enhanced. Thereby, the posterior teeth, the most aspect we are going to consider is the mastication. Missing